Welcome to our webinar this evening. First of all, who are we? Well, the Cosmetic Centre was created from the training side of our business. So Cosmetic Courses is the UK's leading training academy for medical professionals. So we train doctors, dentists, nurses in aesthetic treatments such as Botox and filler. We operate across a number of locations, and in 4 of those locations, so London, Nottingham, Leeds and Buckinghamshire, we have clinics where patients can come and receive private treatments from experienced medical professionals. So we like to think our ethos is to provide safe treatments and holistic treatments. So first of all, I've got 2 colleagues joining me today. Between us, we've got over 35 years of aesthetic experience, and I also like to think a lot of life experience. So we've got 8 children between us, 2 sets of twins, and one of us has 2 goats as well. So lots to think about. So I'm Dr Fiona Durban. I'm based in our Buckinghamshire location. I've been a doctor now for over 20 years and practicing aesthetic medicine for over 10 years. So I'm clinical lead in our Buckinghamshire Centre, so I train and I practice in clinic as well. So if I can introduce you to Dr Olha, first of all.
Hello everyone, and nice to meet you all. So I have a dental background. I'm a dental surgeon, and in 2011 I discovered facial aesthetics, where I absolutely fell in love with this industry, and since then I have diversified my career. I still practice dentistry, but it's a very small part of my clinical work, more like a hobby now, and my main career is in facial aesthetics. I'm based in Nottingham, in Midlands. I'm a clinical lead for Cosmetic Courses. I have a clinic in Nottingham and Cosmetic Centre in Derby, which is in partnership with Cosmetic Courses. And one of the greatest achievements last year was for me probably writing a book, which is orientated towards the patient and explain all aspects about facial aesthetic, positive aging, and in some way it's a guide that helps to empower women, break the myths and barriers about facial aesthetics, and answer a lot of questions. So if you will want to find out more, this book is available on Amazon, and I believe you can get it through Cosmetic Centre website as well. So it's a very interesting guide to read if you're considering or interested in cosmetic treatments.
Thanks, Ola. And Emma, if you want to introduce yourself.
So hi everybody, I'm Emma. I am a nurse prescriber, and I've been with Cosmetic Courses for about 4 years, working as a trainer. I've also worked in medical aesthetics for 14 years, since 2008, full time. And I have my own clinic, and I've had my own clinic for about 7 years, and I'm based in Oxford, Northamptonshire. And I've put on my list to read your book this year, Ola. So
on the to-do list. So I think it's nice. We're all from different backgrounds, but all also provide aesthetics. So that might be that we've got sort of different opinions or discussion points around things. So you can ask us any questions in the Q&A section. If you want to type any questions, we will look at answering those later. So first, who are our patients? And I would say our patients are wide-ranging. We see younger patients who want augmentation cosmetically, maybe of their lips or cheeks or defined jawlines. And we see slightly older patients who perhaps want to refresh, rejuvenate, look at anti-aging treatments. And we see both men and women. Men are still a minority of our patients, but I think that's definitely increasing. And I would say particularly since COVID, I've certainly seen in clinic here more men coming through. That might be interesting to say why, but definitely treatments are becoming more popular for everyone. I would still say, and I don't know if this is the same in your locations, but our bulk of our patients are still the lady who wants to look her best, look refreshed, look at anti-aging treatments are the mainstay of my patients. So when we ask them concerns, The top three really is always lower face laxity. They don't like their jowls or laxity around their mouth. They don't like their under eye area. But more importantly, actually, we're seeing an increase of people who are interested in skin quality as well, which I think is really good. That they're interested in home care products, skin products of high quality to improve that, as well as treatments we do. So Ola, I don't know if you can run through why is the lower face such an area of concern for lots of our patients?
So aging process is very complex, and we have multiple layers of our face. So if we would think the changes that we see on our skin is not only a result of skin aging, and I believe that what we all do at Cosmetic Center, and Fiona and Emma will agree with me, that we spend a lot of part of the consultation process educating patient and explaining the cause of aging. So the aging process starts quite early. There is no one fixed number for that, but average we say around 25. And it starts with changes in the skin, such as a decrease of collagen and elastin production. Some people might have problem even at earlier age, for example, acne, rosacea, dynamic lines as a result of facial expression, and that results in muscle hyperactivity, which is other cause of aging process, which result in formation of lines like frown lines, smile lines, and also I would say one of the major contribution towards facial changing with age is volume loss or volume redistribution, and that is where we see patient coming with the concern because they feel they look heavy around the jawline, or they feel that there is skin become loose, like skin laxity, their jaw become less defined, their lower eyelid could be either a little bit hollow or elongated, or some people might notice formation of the eye bags, heaviness in the upper eyelid. So that is all resulted of the loss of volume, which is our fat in the face, which is a fat essential for nice defined lifting effect, as well as a reduction in the strength of our ligaments. And further down the line, as we're reaching premenopausal and menopausal period, we're also observing some changes in the structure of the face, like bony structure. So as a result of all those processes, our whole face can change its shape from the, usually we consider when the patient is young, we call it triangle of use or V-shaped face. And that is what often we try to achieve with certain aesthetic procedure. And as we're getting older, this triangle of use becomes either reversed, or we can call it rectangle of age, where the face becomes more square shape. And I absolutely agree with Fiona that majority of patients that we see in clinic, and I would say it slightly varies to gender, because females have more concern around lower part of the face. When I see men in clinic, their main concerns always around the eyes as kind of #1 priority. And in aesthetic clinic, we have a multiple treatment option that can address different layers of our face to achieve optimum result. I think it's unrealistic to think that one treatment will be solution for all the problems.
Yeah, what would you say is the best way to prevent some of these signs of aging?
I certainly a great advocate and believer of prevention, but we also need to be realistic, because we have patients coming to our clinic at the different stages of their life. And if you know about prevention and can prevent things, I would say starting with looking after your skin and investing in your skin at the early age. As soon as you see changes and they are concerning you, I think it's the right time to get professional advice and consultation, because what's right for one person might be slightly different for the other patient. So it's always more bespoke advice. One thing where I think you can never go wrong is using SPF. That is a great prevention that can be applied to anyone. Absolutely healthy lifestyle, because we know exercise and healthy diet does help us to feel better and look better and impact on our skin health. And if you have a great skincare regime, it's a big bonus as well. So I would advise just take one step further and explore what treatment in clinic can help you to achieve your goals.
I'm always surprised by the number of people who come asking about expensive treatments, because they are expensive treatments, who aren't using an SPF or who think factor 15 in their makeup is enough. So Emma, what do you try and get all of your patients onto? What would you suggest with skincare and SPF factors? What should they look at?
I think you're right, Fiona, that so many patients, they want to reach for the injectables, but when you have that initial consultation and you talk to them about, you know, the solid foundation for their anti-aging process, they've often skipped some of the real basic things that they can do, such as SPF, things like retinol, looking after their skin, avoiding doing things, you know, we all like to obviously engage in tanning, but ultimately that is going to be one of the biggest downfalls of your collagen elastin and your aging process, is exposing yourself to the sun. So we often start at consultation, and like you say, Ola, that's so true, because so many people are dabbling on the internet trying to create themselves a regime or a treatment plan, but there's just information overload. And often at a consultation, that's what we do. We talk to them about those fundamental building blocks before then we can start to think about their aging process and what perhaps injectables, etc., might be correct for them.
I always think that if they can do a good practice of what they're using at home every day, that will make all the other treatments we might plan work better, look better, last longer. But looking at this, I mean, this slide is telling you there are lots of different treatments, aren't there? And someone might be looking at home saying, well, when do I go and ask for Botox? When do I go and ask for filler? So I know it's a huge subject, Emma, but what would you, I mean, which of these are your most popular treatment? What do you do most of? When would you say one is more appropriate than another?
So I think you've got sort of like, well, you've got two types of kind of aesthetics, really. You've got that beautification, and then you've got that kind of rejuvenation. And I would do a lot more rejuvenation. So most of my client base and a lot of the clients that we see at the cosmetic courses are rejuvenation. And those are patients coming with sort of early signs of aging or even advanced signs of aging. And often we have to look at perhaps a bespoke treatment plan, looking at fundamentals of skincare and biostimulators and getting their skin up to level. And then talking about maybe if we simplify it to the patient, we'll often talk about toxin being suitable for the sort of upper face. And for the sort of lower face, we often look at things like dermal fillers, biostimulators, skin boosters, microneedling, peels. And I guess it's sometimes just from our expertise, we can often look at a patient and just know what is going to give that patient the best results, because it's not always obvious. The patient may come and say, I've read about something, and in theoretical, it's a great treatment, but we just know from all of our experience that that's probably not what's going to give them a better result than something that we would recommend.
Yeah,
So
and I think it's fair to say, really, the patient that gets the best result is going to come regularly for maintenance of treatment, but also might have more than one of these treatments because they all target different things. Ola, is that what you find with your patients, or do they tend to stick?
I would absolutely agree with both of you ladies that I think consistency is the key. And we would need to understand what our patient would like to achieve, and usually we will create a plan to achieve their goal, where they would like to be, is it's with their skin or aging process, or achieve a lifting effect, or improve definition and structure of the face. So it could be often combination of topical and injectable treatments. And once this result is achieved, I think there is a lot of myths and misconceptions. Like, some people often worry, what will happen when the effect will start to wear off? Will my skin become looser? I don't know if you get the same kind of questions sometimes. Would I will look worse, or do I need to keep up with it? I would say most patients, the reason why they need to keep up with it, because they want to maintain the result, and gradually we can achieve even greater result because we laid a great foundation. And after this achieved, we can do just little treatments and often put patient on the right protocol. And sometimes this protocol could be changed depending on the clinical presentation. It's not the case where you need every 3 months have injection of Botox. It might be that you need a biostimulator, or you might need to have a chemical peel, or you might need to have a treatment with energy-based device to achieve the best result at the time. I think it's very important to have this patient-practitioner relationship where you trust the practitioner as a patient, and practitioner gives you the best advice at the time, depending on your skin and facial presentation. But I would say it's a journey. It's a journey.
And I agree. I think what I see from patients sometimes coming from elsewhere is they've been having the same treatment for 10 years. They've been having upper face Botox, they're lovely and smooth, but it doesn't marry up with their lower face because no one suggested they have anything there. And I think the benefit of going to someone with experience is that you should be suggesting things change with time, and you need to be suggesting things as they change, or equally change how you do a treatment. You might have had 3 areas of Botox, and as we age and our eyelids get heavier, you might need to suggest, well, actually perhaps a brow lift with Botox is better. So I think it's also recognizing those changes, and I think a lot of practitioners do, should I say, the same on everyone.
Absolutely, yeah.
Yes, I so much agree with you on that, Fiona. And what I also would say, it's important to keep patient in face in harmony, because I don't know what your opinion, ladies, but I'm sure that we have the same. That sometimes I feel if patient come to us at certain age and we just decide to correct one area because of some limitation, it might be budget limitation, it might be that patient only interested in this one area, it can make this patient look very obvious that they have had treatment. Because would you agree, if at 50 years old we just do the lip augmentation and ignore the rest of the face, sometimes we can put this perioral area in disbalance. And when it would be better probably to have a skin booster treatment and improve the skin quality overall, rather than just focus on all areas. I think it's very important to understand this right balance of the facial proportion, harmony, and anatomy of the aging face.
Yeah, absolutely. Emma, do you have anything to add about that? This is kind of showing some pictures, if that helps.
Yeah, and I completely agree. I think that, again, I think the way that patients sort of approach their sort of anti-aging is that often they come when things are starting to becoming quite advanced, and at that stage they often might have just one line or wrinkle in mind that's bothering them. And whilst we as practitioners don't want to draw attention to other aging processes that are what are happening, that is actually part of our role to advise a better, more bespoke journey, so they can understand fundamentally how the next few years should play out in terms of their aging process and the treatment options.
Yeah, but I would say I think our goal certainly here is I wouldn't want any of my patients to be recognised on the street, by which I mean I think the best results are ones that can't be seen. They just
Harmony,
as good as they can.
Word.
We're not after results that someone looks at you and knows instantly that you've had everything done. And some practitioners, that is what their aim is, but personally our ethos, I would hope, isn't that. But equally appreciating that results are subtle. So this slide sort of says non-surgical facelift. I worry sometimes that that portrays an expectation that is incorrect. You know, this is not surgery. A surgical facelift is very different. But I think this result shows a nice subtle change, particularly to the jawline, where the patient just feels she looks a better version of herself, that a little bit lifted, obviously without the downtime or expensive surgery. And explaining that to a patient and managing expectations, I think is really important, that they don't expect. Again, you might want to comment on this slide. This is just showing some lip augmentation. Ola, do you want to say anything about sort of lip filler and
So again, I think it's a very interesting slide, because we have male lips, we have aging perioral area, and then we have a patient with the younger lips. So, and it is important to realize different demographic and age, different age group goals. So very often, for example, if I will just start a little bit of a description from middle picture, most of the time when we see age-related changes around the lip, perioral lines is a very common concern. And often patient comes, they've probably done some research and they think that the filler is the right option for them. So, and sometimes if you just deliver what patient asks without educating, you can make the situation worse, because if you fill up the lines, you will soften the lines, but you will add age to the face, because you will make upper white part of the lip quite heavy. And that is not considered as attractive aesthetic outcome. When you choose correct product and nicely, very subtle, like in this case, define the lip, give a little bit of a structure and slight volumization. On this picture, the treatment, this picture was just after the treatment immediately, which is quite subtle, but it improves overall perioral area and reduce appearance of the line. So that demonstrates that it is important to treat the cause rather than the problem. Sometimes where we see the problem, it's not necessarily the area that needs to be treated.
No. And that's a good example, Emma, isn't it, of an area that can be treated in different ways, because we can use toxin here, we can use skin boosters here. I don't know what
exactly.
One of my favorite areas to treat is perioral, because I have such a passion for a female lady who is aging and starting to really see the aging process, but is absolutely terrified of lip filler. Because for me, I obviously have to explain to them that sometimes I am using dermal filler in the area, but I wouldn't really call it lip filler. And because that's not my aim. My aim isn't to make their lips bigger, but it might be that I do need to do a little bit of work around the mouth, in combination with some Botox often, and sometimes in combination with some skincare. And I think that seeing a female maybe in their 40s or 50s get this wonderful result and realize that the area can look so much more rejuvenated, but they don't appear to have any work done, it really creates a feel-good factor when we've got the expertise to do that.
Yeah. And then this is just again showing an area you might not consider. So non-surgical rhinoplasty. So these are patients who have a bump or a something with their profile that they dislike, and actually we can use filler product to change the shape of their nose, the profile of their nose, which are used to be results that could only be achieved with surgery. And Ola, I know you like teaching this and performing this, but these are quite nice results that actually patients are really happy with, aren't they? And actually long-lasting results. It can last quite a long time.
Sometimes I would say, in my experience, non-surgical rhinoplasty is one of the most satisfactory cosmetic procedure, because very often, if you're unhappy with something and you can change it within a matter of minutes with relatively very little, if no downtime at all. And I would say it is a risky procedure, so you definitely need to choose an experienced practitioner, because there is a lot of important vascular structures, so safety is quite important. Make sure you do the right research.
So just to give a couple of examples of patients that we've seen, Ola, would you like to talk us through this lady's journey? Because this is sort of a very typical patient who might come to clinic and what they might want to achieve.
So this is interesting slide, and so it says that the patient 57 years old, which is exactly right for the picture before, but the picture after, the patient is 63. So there is 6 years difference in this picture, and this is one of my patients, and she's now work in the clinic as our clinic manager, but we started our relation so she was my patient, and when she came first, her main concern was aging face. She wasn't happy with the eye bags. It was main concern, and she was under impression that nothing can be done except surgery for that area. So you can see that 6 years later she doesn't have eye bags, and it didn't happen overnight. So that was a working process. So through time, through 6 years, she have had a number of treatments, which included non-surgical facelift, like treatment with dermafillers of temples, cheeks, jawline, chin area, lip augmentation. She have had PDO threads treatment, just to tighten the skin and improve volume redistribution. And also she have had a session of carboxytherapy, which is quite, for certain patients, could be quite effective to reduce appearance of the eye bag. She have had a tear trough treatment, which is filler injected around lower eyelid area to reduce appearance of dark circles, or in certain cases improve appearance of eye bags, as well as she had lip augmentation. Now, this patient has an excellent skincare routine at home. She used the best products religiously, applying SPF. She has a regular treatments in clinic, and now she in maintenance process where her injectable needs is not as high, despite the age group where we still will see a high need for patient. But once result achieved, what usually our protocol will involve is we see patient on a regular basis, and on a regular basis, I would say it may be every 4 to 6 months in clinic, depends how often you available to come and how often you want to have the treatment. Obviously, as she working in the clinic, I see my patient almost every day.
I mean, this is a really nice result.
And we would address the required areas at the time. So it might be the case that at this appointment, we need to give a little bit definition to the cheeks, and 3-4 months later, we will have a look and address a little bit the jawline, because women in maintenance process, we don't need to perform non-surgical facelift or look at the full face again. We just maintaining what has been achieved and slightly reversing signs of aging.
So I think this is also a good example of what's touched on before, that if you are looking at the full picture, like building a house, we look at structure first. So if someone's never had any treatments, we want to look at points of the face that are going to help shape and lift before we do what we say is refinement, which tends to be things like tear trough filler, lip filler, creases, because you'll always get a better result if there is that order maintained with treatments, rather than a patient just come and say, I would like my nose to mouth line softened. You would get a better result to lift from the cheeks first. So looking at what we call a full face approach, you'll always get a better result. Emma, is that kind of what you would do as well?
Yeah, absolutely. I think that the evolution of aesthetics has really changed in 14 years, because really and truly 14 years ago we were just chasing A-line or wrinkle, but we really understand the aging process now, and that's fundamentally what we're treating as experienced practitioners, and how we're able to guide our patients is because we understand the aging process now. We can talk to them about how we can actually use treatments to target why they're aging, and do that before we get to the refinement part.
And I think with knowledge, also the development of products, that leads us really nicely onto this new product by Allergan, which I know, Emma, you've used for quite a while now, but we're also using across the Cosmetic Centre and also in our training. So do you want to tell us a bit about it?
It's a very, very exciting product. It's called Harmonica, and lots of people are still pronouncing it Harmony CA. So just get our head around the pronunciation. And I attended the launch for Harmonica around April last year. And like any new product, I was just a little bit slow and steady and careful before I started, talking to my patients about it. So I took a little bit of time to find my feet with it. It's a hybrid product. It's a product that is 70% hyaluronic acid and 30% calcium hydroxyapatite. We all obviously are familiar with the hyaluronic acid, and the hyaluronic acid part of the product is the carrier, if you like, of the calcium hydroxyapatite. And when we inject this product, it's fanned into this part of the face with a cannula, so normally with just 2 entry points, and we have this instant effect, which is hydration, and we have a little bit of skin tightening, and we do have some really subtle lifting, and that's the sort of first part, if you like, of what this product does. That's 70% hyaluronic acid, but then you've got the biostimulator part of the product. And this is what is kind of pounding your natural collagen and elastin. It's inducing a response. So normally what we would see is a gradual process over about 6 to 12 weeks of the patient's collagen and elastin improving. And what that is actually presenting in terms of results has been actually fascinating for me as a practitioner, because my case studies have been drip fed slowly throughout last year, and around about sort of November, I started to think this is a really, really good product, and we're seeing some really, really great results. Now, of course, like anything, it has limitations, and managing patients' expectations is important, and also patient selection. But I think this product is kind of going to suit any patient. I mean, this is just sort of saying my demographic and the types of patients that I'm seeing at cosmetic courses and suggesting this product. Lots of patients at cosmetic courses have already had dermal filler and they've got a really lovely result, but they just need that sort of extra push, if you like. And this is where this product seems to come into sort of play. And it's a new product in the sense, like, yes, it's new to the UK, but it has been around a long time. In the calcium hydroxyapatite has been around a long time, and so has hyaluronic acid. So to put the two together and repurpose them is a great idea. So the safety profile is fantastic. We've seen very minimal downtime with this product. I had the product myself and about 6 weeks ago, and the downtime was just very, very minor, just a couple of little bruises at the entry points. Now, of course, we may have patients that may have more downtime, and we always sort of try to factor that in, but majority of our patients have seen minimal downtime.
It's combining that lift with some rejuvenation as well. And I know people watching might have seen, because it was featured in the Daily Mail recently, wasn't it? Because Shirley Ballas has come out to saying this is what she had as part of her transformation this year on Strictly. I know she's had other treatments as well, but I believe this is the product that they used to.
This is absolutely it. And I think initially when it came out at the launch, it was very much pitched to the accordion lines, and these are the lines here, and they've always been a challenge in aesthetics to target. But as this product, as I've evolved with these products, what I'm seeing is it's not just targeting accordion lines, it's targeting the skin quality, the skin bounce, the skin stretch. And we've seen some really nice results, the sort of tightening of the jawline around here. But because the product is injected mainly into this area, we're actually seeing some nice improvements in the nasolabial folds and the pre-gel sulcus. So we're seeing kind of a multitude of results, but in terms of its lift and its skin quality, those are the two things that I'm really excited about.
Yeah, so it's one to watch for 2023.
100%. And yeah.
So I think if people are watching who haven't yet taken that step because they're anxious about, taking a step to injectable treatments or into aesthetics, often what they're concerned about is safety. So whether it's to one of our clinics or elsewhere, Ola, what are the things that you feel, and this slide sort of goes through them, should they look for in terms of where to go and have their treatments?
Well, I think all the questions on this slide are very important. And I think they are very good questions. So I would advise anyone who watches a webinar, take a picture or a note of this question, because aesthetic treatments, they could be life-changing for people in a very positive way, because it is a fact that when we look good, we feel good. So it's reflect on our day-to-day life, and as well as it could be life-altering changes, because if we have a problem and it is on our face, it's very difficult to hide and not always as simple to correct as some people imagine. Sadly, I think we see more incorrect treatments and complications because aesthetic is unregulated, and in the UK literally anyone can perform injectable treatments. We all hope that it will change soon, but I think most important, your practitioner definitely need to have a medical background. I think sometimes people pay more attention when they look, for example, for a good hairstylist than they do when they search for aesthetic practitioner. You don't want someone who just decided that they can do hairdressing, do your hair, total revamp, bleach, cut and restyle. You always want to go to a nice place where you know that people do a good job. I think you need to be even extra careful and do your research when it's come to medical aesthetics. So medical background is paramount. So where they practice from, it's not a law that clinic need to be CQC registered, but it's a good indicator because Care Quality Commission ensures standards. And there is also some other platforms where reputable practitioner could be registered, like Safe Face. It's also where you can find medically qualified practitioner. How regularly do they do treatment? Because you still can be the most experienced general practitioner, dentist, but quite new to aesthetic. And it doesn't mean that patient doesn't need to go to this practitioner, because we all started from somewhere and we all learn, but it's important that they practice within their area of expertise. And most definitely all medical practitioners will be ethical and honest with their patient, because that is a code of conduct that we are practicing under. Training, of course, it's important that they completed the right training. You should ask definitely a question about the product, because there are many unregulated products in the UK, especially when it's come to derma filler. And even topical treatments, they incorporate certain risks, like chemical peels, even incorrectly prescribed skincare products could cause reaction and rashes on the skin. So it's important that practitioners have the right expertise in the treatment that they offer and prescribe to the patient. And you definitely shouldn't have been forced into treatment. You need to have a consultation. Usually, we always encourage patients to consider and think about treatment option after consultation. I would say it would be rather exceptional circumstances when treatment will be done following the consultation. Mostly if the patient have already experienced, they know what they want, they probably moved to the areas, they have had regular treatment, and they just probably changing practitioners. Still, we want to get to know the patient, give them option, and then book them for the correct treatment. And a follow-up appointment, you always need to ask about all possible questions before you have the treatment, such as, will you have a review appointment? Does it involve any extra cost? Ask even about side effects, because every single treatment has some sort of side effects, some sort of downtime. So, and you need to be prepared for that, because you certainly don't want to have injectable treatments and tomorrow have important meeting and unfortunately develop a bruise.
So Emma, what would you say to someone who said, oh, I'm going to go to a Botox party tomorrow at my friend's house?
I think what we've seen in the aesthetic industry in the last couple of years is I do think there's a lot of education out there. And whilst the industry is unregulated, I think that the patient needs to start taking some responsibility for their choices about where they go, because there is access to that information out there. And, what should I be choosing in my practitioner? So everything that Ola says is really important. And Botox parties are not on that list of how to find a safe practitioner. So if a patient says that to me, then it's what can I say? You've got a different motivation maybe in terms of what you're trying to find in the treatment that you're having, and different sort of reasons for wanting to take that route. So I generally don't say a lot other than perhaps research kind of yourself how to find a practitioner. But
and I think generally that doesn't mean shopping around for the cheapest service.
Absolutely not.
It's like anything, you pay for quality, because the products are going to be more expensive if they're a higher quality. Obviously your practitioner's time, and even word of mouth. I think I would say all my best patients are referrals from other people. So offering a good service, giving the patient what they want, and them being happy with what you've achieved, and referring someone else has got to be a marker that you're actually doing a good job.
They are sensible prices for these things, and I think that's the bottom line, that people if you kind of do some research, you'll see that there are prices that are quite sensible and offering a balance of everything that you should get in a practitioner, and the quality of the products that are using. And then there's massive disjoints, and there's a reason for those disjoints. And
so these are a few questions I think we put together, and we can put all of them on the screen and perhaps pick out a few of myths or things that common things that people say or ask us Ola, do you want to pick one out that you can answer easily or quickly?
Well, I would say, so we just been talking about different deals and prices, and here is the question: the cheapest deal is the best deal. I would say that is absolutely not, and I would say almost recipe sometimes for the disaster, because often you'll find you will pay more for corrective work, but not just in terms of financial implication, but in terms of distress, anxiety, and sometimes it can completely, I think one of the reasons why it's put a bad reputation on the industry, because very often it's this cheap deals that results in disastrous outcome. Because as rewarding cosmetic treatment can be, it could be equally dangerous, where it can result in permanent disfigurement of the face, in the scar formation, in the asymmetry of the face, in the infections that in some cases require hospitalization, and to the worst case scenario affecting permanently eyesight if the dermafiller injected incorrectly. So I think definitely do your research. And if you don't feel happy and confident, don't have trust in the clinic practitioner, just look for that. Don't stop. Personal recommendations always the best, but always I would say read reviews. There are multiple platforms and a lot of available on social media these days. You not necessarily need to be led only by that, but I think, in my opinion, I would say personal recommendation always the best.
Okay, and Emma, is there one on there that...
Can you read one out to me, Fiona, because I can't see them, so I'll take the one you throw at me.
Okay, so will Botox make me look frozen?
Absolutely not, but yes, it can. Yeah, so it really depends on what your wants are, because there are patients that actually do want a more frozen look, and then there are patients that want to, you know, have a more natural look. So that's really about working with the experience of your practitioner to make a treatment plan that's suitable and meeting your expectations.
So I'm going to answer. So it says 1 ml is a huge amount. And I think this is really difficult, because typically a syringe of filler is 1 ml, and it's often very difficult to visualize how much that is, especially when it, on the face of it, is expensive for one syringe. And when I say to patients, well, that's 1/5 of a teaspoon, it is a tiny amount that you're expecting to sometimes make this big change. And equally, that by the time we're 40, we've usually lost at least 4 to 5 mils of natural volume from our face. So explaining to patients that in some cases, just to get back what we've lost is going to be sort of four of these syringes, and understanding that it isn't a huge amount. So I think, again, that's about discussing with your practitioner what your need is, what your expectations is, and how that can be achieved. Because understanding it as a volume is very difficult. I mean, between us, what if I don't like the results? Ola, what would you say to that?
So I would say it is, if you've done your research and you went to a reputable, ethical, experienced practitioner and clinic, most likely you will like the result of treatment. And I will explain why: because you will be listened, your concern will be addressed, and the right treatment will be prescribed to you. Because usually it's not the case where the beauty about non-surgical treatments that we can start this process slow. So we can start with a small amount, work together, we will be achieving the change gradually. Now let's just look. So most likely with the right research, result will be pleasing for the patient. But if we take a situation where, let's say, something, because things can go wrong even in the most experienced hands. So usually non-surgical treatment, the beauty about them is like a lot of procedures reversible, where we have the right medication, where we can reverse the side effects or unpleasing aesthetic outcome of the treatment. But I would say that is in exceptional situations. So usually this situation can be avoided if you listen, if practitioner understand you correctly, and if you done and undergoing the treatment when you fully understand and happy to have it. I think it's definitely need to be decision that you don't take lightly. Just woke up today and said, I'm just trying on surgical facelift and see what what it's like. It's usually decisions that most people take time to consider, outweigh the benefits, and make a formal decision and happy to go ahead with the treatment. And if we talk about topical treatments, I would say in my clinical experience in 10 years practicing anesthetic, I never heard the patient said, I don't like that my skin is nice and glowy and fresh and even. I think everyone just loves their healthy glowing skin. Would you agree with me?
Yeah. I'm just looking at questions people have sent on. There's a few regarding harmonica, Emma. Why can't you have any other fillers for 12 months after harmonica?
That's not the case. What we've been training, and obviously this may evolve and it may change, but the minute we're saying 8 weeks after you can have dermal filler after.
To the same area we're talking.
Yeah, to the same area, yeah, but certainly not 12.
No,
so not 12 months.
It takes 8 weeks to integrate to the tissue, so you don't want filler for that 8 weeks. But after 8 weeks, that can be reviewed and you can have filler. And a quick one to answer, it says, what is the life expectancy of harmonica? Well, it can effectively last certainly a year, but longer than that.
Yeah, I mean, product manufacturing, they're saying 18 months. And I suppose that's the only caveat that I'm saying to my patients. It's a new product and I haven't seen that with my own eyes yet. But in terms of the results that I've seen, certainly I've seen them 6 months later looking amazing. So I can't imagine it's going to suddenly disappear.
No.
Yeah.
And another one, a lot about sort of related to harmonica, what would be the main factors to help you choose between a non-surgical facelift or harmonica? I think sometimes actually you need both. You know, if you need shape and structure, then you might be better to have the non-surgical facelift first. If it's more rejuvenation and a little bit of extra lift, then harmonica is then possibly the way. I think
that's important. Yeah, that harmonica is lifting, but it's definitely not lifting in the way that maybe a 7-point shape would, or a 9-point shape for a male. So I think if their main focus is kind of lift and shape, then we should be looking at a non-surgical facelift, and the harmonica is just kind of like icing the cake. But if you've got a patient that wants quite a natural look and they just want their skin to have a really good kind of boost in their collagen elastin and a little bit of lift, then I think harmonica is a great product. But combination treatment, again, can work really well.
So ultimately, though, perhaps going for a consultation and discussing that with a practitioner is the way to go if you're not sure. And certainly we would offer consultations if you
absolutely, yeah, consultation is key.
So Ola, there's one about hands, that often their face can look cared for and supported, but the hands give the process away. What do you have by a way of treatments for sort of hands and other rejuvenation?
Good news that we do have a treatment portfolio that can help with rejuvenation of the skin of the hands, as well as restoring volume loss in the hands, because often, and it's a very valid question, because we use our hands a lot and often we not always appreciate them as much as our face. Like I work in the industry and I'll put my hands up. I don't put hand cream every day, despite I should be doing that. So when it comes to hands rejuvenation, and it was also a question about upper arm, isn't it? So it's not just palms. was upper. You mentioned, Fiona, can you repeat the question? Was
Yeah,
it
what do you have by way of treatment for hands, arms, underarms, and all over skin rejuvenation?
Okay, so for hands, upper arms, and overall skin rejuvenation. So, for example, if we talk about hands, which will be actually a very common concern, and I would say from body rejuvenation treatment, it's very popular area. So again, skin boost. So if you're talking about injectable option, we can offer skin booster treatment, which is fantastic for improving hydration of the skin, reducing appearance of the fine lines on the hands, and keep a nice hydration of the skin. When it comes towards volume loss, we can use volumizing fillers as well to restore volume loss and reduce like a bony appearance on the hands, as well as the collagen boosting treatment. So there is a certain products that we can use for rejuvenation of the hands, and one of the products that has been used for hands rejuvenation for a long time is calcium hydroxyapatite, which is a part of harmonica. So it has been previously in the form of radius and widely used for the hands. So Emma, you have a great experience with harmonica. Would you use it for hands rejuvenation or not?
I like to think that as time progresses, then absolutely, I can see that it would definitely have value. We're not using it for hands at this stage, but absolutely, I think this product will evolve.
I think the other area people are worried about often is necks. It's the same thing, isn't it? And more I'm seeing patients for treatment of their necks where often Botox in the form of what we call an FATT to relax the bands in the neck, and then combination again of skin boosters which help hydrate and stimulate collagen. People can get really nice results in the neck because I think like hands, that can definitely give the game away. So there are things we can do for other areas. It's just again worth coming for a consultation and asking about them if there are areas of concern. Is there
Sorry, Fiona, I just wanted to add, because it was question about arms. So because upper arm laxity often is also a concern of the patient, and we can do treatments such as in my clinic, I offer a PDO thread, which is a very good collagen stimulating option, as well as skin tightening. And I also use polylactic filler, which is again rejuvenates the skin and reduce skin elastosis, so it can be widely used
other things
on different areas of the body.
But I think it's also worth saying that a good practitioner will tell you when something isn't possible, because our non-surgical treatments don't answer all problems, and
exactly
we need to advise that perhaps a surgical consultation, or be honest and say that we don't think that the results can be achieved that a patient's expecting. And I think a good practitioner will always be honest with you rather than suggest something that we know perhaps isn't going to deliver what you hoped for. Would you say? This is just a slide to say, you know, if you are interested in anything we've talked about and you would like to come for a consultation, you can get in touch with us. We will obviously offer a consultation with a practitioner. There is an incentive if you've watched the webinar for getting discount from your first treatment, but that would not include toxin, because that's a prescribed medication that we would use the discount for skin treatment or filler treatment, and an incentive to bring a friend along as well, perhaps both come for a consultation with a practitioner and look at what we can offer you. So if you have any further questions or we haven't answered your questions, again, you can email us or phone us and one of us can answer you directly if there's something else you want to know. But thank you, Ola and Emma, for lots of hints and tips and your knowledge. Hopefully people have found it quite informative.